Hi, my name is Donna, a volunteer with the Medical Reserve Corps of Greater Kansas City. In this video, we will be discussing mental health issues in a disaster shelter. As volunteers, we need to be aware that there will be disaster survivors with mental health issues that may need to be addressed while providing for their comfort and safety. Many people coming to a shelter may be dealing with mental health issues. Some will have new issues due to the disaster, and some will have existing issues, possibly made worse by the disaster. Our job as volunteers in a disaster shelter is to be aware of mental health issues and to provide support and direction to the survivors who are having difficulty coping with their mental health issues. Mental health disorders are common. 1 in 4 adults have a mental health disorder. There are many types of mental health disorders, such as anxiety, major depression, substance abuse, bipolar disorder, eating disorders, and schizophrenia. Regardless of what kind of disorder, we need to assess if a person is having trouble coping in the shelter, so that we can direct them to mental health professionals who can provide safe, helpful guidance and treatment for them. There are several ways to help a person who is having a mental health crisis. As volunteers, we need to be alert for a person who may be developing a mental health issue. Assess for possible mental health problems. Some behaviors that may develop include verbally threatening to harm themselves or others, acting out inappropriately, seeing or hearing things that aren't really there, or becoming delusional. They may withdraw from people around them or refuse to eat. An important way to help someone in crisis is to listen non-judgmentally. Give the person the opportunity to discuss their situation. The key is to be caring and gentle. Find somewhere they can talk safely and that is free from distractions. Don't force a conversation if it's not wanted. Allow them to talk about their experiences at their own pace. And don't touch them without permission. Respect the person's beliefs, even if you don't agree. Another way to help someone who is having a mental health problem or crisis is to give reassurance and information. Say why you are worried about them, but avoid talk of mental illness or diagnosis. Ask the person what will help them feel safe and in control. Let them know that help is available, and if they don't want to talk, they are welcome to talk at a later time. If a person is having a hard time distinguishing what is real from what is not, don't deny, dismiss, laugh at, or argue. This rarely helps. It is always possible to empathize with whatever emotions are stirred up by the experience, and this can be very comforting. Be honest and don't make promises you cannot keep. Encourage appropriate professional help by helping the person find a doctor, nurse, or mental health professional located in the shelter.